Good evening. Today I have as my guest Dr. Ramtin Massoudi. And Dr. Ramtin Massoudi is a specialist in cosmetic and laser surgery. And he is also, important to say, that board certified from the American Academy of Anti-Aging and Regenerative Medicine. Welcome to our program, Doctor.
Thank you so much.
So today we are going to address more aging issues, because I know that's your specialty. And I do understand that this might vary from person to person, and there's many factors involved in aging, but generally on average, at what age does skin start to show the signs of aging?
It's very hard to say, but in average, anything above 30, 35, 40, it's, as you said, different factors. But in females, when the estrogen starts decreasing, and in males, it's a little later, could be around 40, 45, 40 plus. But the main factors is sun, smoking, diseases, eating not healthy, people are like eating processed food. There's so many other things.
Lots of sugar maybe.
A lot of sugar, all those things are factors. So, but the age I don't have a right age for it, but aging starts from the second you born. You start deteriorating.
Correct.
So, but you have to protect yourself, you have to eat healthy, you have to prevent, all those things. But for just 30 is not a bad idea. People go to their doctor and say, okay, what can I do to prevent? And if there's any correction we need to do it at that time.
Okay. Now, what happens to the skin as we mature and we age?
There's 2 or 3 things that happens very rapidly around age of 30 something, which is loss of estrogen. Estrogen decreases over time. And when estrogen decreases, the fat decreases in our body.
This is for women.
Exactly. But in male also, the hormone decreases on both. And that's the one that produces more fat. And so the fat decreases, and certain fats die completely, depending on the layer of the skin. And if you look at someone, someone is a baby, 18 years old, or 20 years old, or 26 years old, and all of a sudden the baby fat goes away, they're aged. Is that baby fat gives you the being vibrant, being fresh, you have certain glow to you. And so that baby fat keeps the water also, you see more plump. Imagine you have raisin which is dried up. That's basically when we don't have the fat
versus
and the collagen.
Prune or the plum.
Exactly.
Okay.
So there's many factors, but we can look at even in the temporal area that people lose fat, and this area becomes more flat. Even the forehead becomes more flat. We lose the convex, volume, the convex shape that we have in our forehead.
Right.
Everything, the convex part becomes concave part.
Right.
Or it make it flat, then becomes a little more hollow.
Right.
So a lot of times, just looking at even this area, the temporal area, we can just very easy. We can say this person is 30 years old or 35 years old. So that's my trick. I look at that area. I can.
You can tell.
I can tell.
You can tell.
A lot of people.
Even visually, yeah.
This is a very little hint. A lot of people go and focus on their cheeks, and they want to volumize the cheek area, but the temporal area gives away.
Interesting. Interesting. Now we hear so much about Botox.
Yes.
What is Botox, and who can benefit from it?
Botox,
and is it for everyone?
Botox, tell you the truth, is not my favorite thing to do.
Interesting.
Botox is like, is the vaccine good for you? Yeah. But does the vaccine can help you when you have a disease? No.
No.
So Botox is good in the sense that you don't do a certain repetitive movement that might cause creases and cause a scar formation or deep lines. Yes. In that sense, Botox is good. But Botox, what it cannot do, it cannot produce collagen. It cannot volumize. It cannot give you your fat back. It cannot give your collagen
Right.
back. It cannot heal itself. So what Botox does, relaxes the muscles, and it doesn't let you to do too much of repetitive movement. If you do that, and causing a lot of creases. On one side, Botox is, I think, is very dangerous and it's bad. Not because of it, they call it poison.
Right, right.
The Botox is bad because it decreases the volume of the muscle.
Oh.
And that's when we don't move, the muscle shrinks.
Correct.
So when your muscle shrinks, the forehead falls and the crow's feet falls. Everything, the muscle becomes less and less volume, and you get more droopiness. Botox is good certain times. It's good to do it by understanding that you need to do more filler, replacing the collagen, replacing the fat, rather than just numbing the muscle. So you don't, by paralyzing the muscle, basically you don't let the muscle work, and the muscle where they're not working, you don't lose, you basically
there's
lose the
saying,
volume.
Yeah, they go use it or lose it.
Exactly.
It's just like your
So
other
exactly.
muscles.
Same thing happens in the forehead.
Interesting.
I usually, even for forehead, I try to do more fillers. And I do Botox in order to relax certain muscles I want, because it's interrupting my procedure.
I see.
So sometimes I do it. It's not on regular basis, but cosmetic kind of with advertising in the TVs and everything is linked to Botox.
Right.
Everybody who thinks cosmetic, Botox, but in reality,
exactly.
Botox is not the right answer for everybody.
So it's of limited use.
Yes,
You're saying.
it's basically is good for partial prevention. Sometimes it's good for us to do it because we want to relax and put fillers underneath. Basically.
And like you mentioned, I literally see it everywhere. Everyone's saying we do Botox, we do Botox. Now, can any doctor perform this procedure with Botox?
Botox, there's two ways to it, legally or I always think a person has enough experience and they're licensed for it, maybe yes, maybe no. Because in cosmetic, there's partially science, partially your license, but a lot of insight, and you need a lot of experience. You need the way your mind works. If you're good at 3D, maybe cosmetic is a good field for you. Maybe you understand the anatomy, how everything works. But people blindly, okay, I'm gonna do this muscle, this muscle, then do this muscle. They always get in trouble because you don't, let's say someone has too much loose skin, when you do Botox, it gets worse. Right. So that's the time I always recommend filler. So Botox is good for prevention, but if you have the disease, or which is the wrinkles,
Correct.
it's better to replace the collagen and fat.
I see. So you mentioned fillers. Now, what are fillers and what is their use for
Filler is basically man-made collagen that everybody has it, and every life organism have collagen in their body basically.
Okay.
It's hyaluronic acid, which is a part of our skin, and one of the fillers is hyaluronic acid that becomes and stimulates more collagen production, and it repairs the area that we're not making as much collagen. So it's kind of a repair and rejuvenation.
I see.
It does two things. We have other fillers. They're more stimulators rather than fillers. We call it fillers, but in reality, it doesn't fill anything. It's not a pure collagen. What it is stimulates collagen production, but we still call that filler. Okay. So that's a Sculptra, or certain things like Radius. It has two parts to it. It has a little collagen hyaluronic acid and also has hydroxyapatite, which is calcium based. That's good too. And there are other fillers that not many people know about, but most of fillers that people are familiar with is like Juvederm, Voluma, Restylane, Radius, and Sculptra. Those are the most commonly known fillers.
And are those injected into the face?
Yeah, exactly.
Okay.
Again, when we call it filler, a lot of people think it's a gas station. You need to fill that area and come back. Is a wrong
impression
word for it.
Right.
Fillers are kind of implants. With the right person, with the right placement, you can lift the skin rather than fill the skin.
I see.
So when I talk about lifting, is more important than filling. I had a patient a couple of days ago. She had a filler, per se, in the cheek area, but nothing was lifted. She had the balloon here, she had the ball in here, but the nasolabial fold, which is the laugh line, that shows as a result of falling skin, it was still there.
Oh,
so they didn't correct it. They put it too superficial. When we put fillers, we have to use it in certain parts because let's say in the cheek area, where the area we lose the most fat is underneath of the muscle.
Okay.
Where we passes through here. If you put it superficially, this area gets bigger, but doesn't lift. So that's why right placement and choosing the right product filler in the right place, it can give you the lift rather than filling the gap. Filling when we put it in the right place, I'm going to give you an example.
Yeah, please.
Imagine this is a rod, which is our muscle, and the fat is decreasing underneath. So as a result, this falls.
It sags, right.
It sags down. If we put a filler on top of the muscle, this gets bigger, you get a little bump, but the muscle is not coming up. It's not lifted. But when you put the filler underneath of the muscle, we use that as a little seesaw per se, and we lifting that muscle. As a result, the skin can be lifted together. So placements are very important. Where to start, and what we wanted at the end of the day, there's a philosophy behind cosmetic. The idea is not to get rid of lines. We want to show that person is more vibrant and happier, rather than if looking at you is still sagging, but you have fullness. That's not happiness. When your cheek goes up, as a result, your smile shows. That's the time the happiness and vibrant and those things shows up, and basically
plus it looks more natural too.
It's natural, yes.
Right.
But the idea of cosmetic or anti-aging is taking you back 10 years, taking you back 20 years. But most of the times I see the area is filled, but the effect that we want is not done.
Is not there, right? So the technique is very
important. It's very important
important
placement, and let's say if there are certain fillers that absorbs more water,
I see.
it is better to put it in more permanent areas, and with the areas we need more volume. Certain areas we don't need as much volume, we need just to make it a little more tighter. So we only need fillers that doesn't absorb too much water, but make that area more tensile, more flexibility, and it tightens that skin up.
Right.
So like a forehead, we don't put a filler that or product that causes too much water absorption, make it too much volume in the forehead, let's say.
Sure, sure.
Or the lips, we don't want too much volume.
Correct.
Or under the eyes, we don't need volume, we need just to make it the lines to go away smoother. But in the cheek area, we need more volume to bring that muscle up. So knowing the physics, knowing the anatomy, knowing the movements of the muscle is very important. So as I said, it's science, is art, is medicine, is
It's a combination.
It's combination. The people are good at physics, good at mechanics. They're much better. People are 3D visualizations are better doing procedures like this. That's why I love this.
It is an art form.
Yeah, because
It is.
this is not only is it not B12 injection you do and B12 goes and does its function.
Right.
You have to put it in the right place to do the right lift and bring back that youthfulness and everything. So
Right.
is a combination of everything, and a lot of experience is I think needed, because people get too cocky too soon when they do procedures. Oh, I've done my first lip. I
do
know everything.
Right.
So
And faces are different. People are different.
not causing as much bruising is important. Placement is important. Knowing, sometimes I have the patient bring the picture to see
When they were younger?
10 years,
Okay.
20 years before, what was the dynamic of their face. Females and men's are different, and the way their muscles are, they're different, the way our fat sits is different.
Sure.
So it's very moving parts. So let's say with one filler, someone can lift or fill. When you fill, that person doesn't look younger. It's just more plumped.
Right.
When you put it in the right place, that place not only plumped, is lifted also.
Interesting.
Yeah.
You mentioned collagen and hyaluronic acid.
Yes.
Are those effective also topically?
To a point.
To a certain point. Okay.
Our body is fluid.
Okay.
Our body is not solid. So everything you put on top of the skin can get absorbed, but absorption is not a lot. It's just minimal.
Okay.
You still can absorb things, yes.
Right. So it's probably the same, again, my question about those two. People take orally. They take like collagen. So are those also minimal, the results?
There is, your body doesn't know where you don't have as much collagen.
Correct.
We have, our whole body is collagen. If you say what percentage of my body is collagen, my answer to you, 65% water, the rest is collagen. Everything is collagen.
Interesting.
Your skin is collagen, your veins are collagen, your arteries are collagen, your liver is collagen, around your muscles are collagen, between your muscles are collagen, everything is collagen.
So it's very important part of our body.
Collagen, basically our
Water
body
and
is built
collagen.
up of collagen.
Interesting. Very interesting.
That's our biggest organ.
Wow, very interesting, very interesting. Now, let's move on to laser. When do you use laser to correct any of those problems with our face?
Laser is used in 3 areas mostly.
Okay.
Number 1, superficial part of the skin, when we have pigmentation and very fine lines, and tightening the skin. That's
those 3.
Basically,
Basically,
it helps tiny layers of top layers of skin. It burns, it stimulates collagen production, it gets rid of the pigmentation, and we have other lasers that we can get rid of not only pigmentation, tattoo, and also sometimes veins or spider veins or reticular veins.
You can also use lasers.
Those are very topical, very anything that less than 1 millimeter, we use laser. Anything the depth of it is less than that.
Interesting. Now I think we've come to the end of the program, but a very interesting part of the program. So I would like to ask you, Dr. Massoudi, are you currently offering any specials that our viewers can benefit from?
We have a special, hopefully it works for everybody. For everybody is different because everybody needs different things. But we have, for the fillers, we have buy one, get one free. So basically you buy one, you get the second one free.
For free.
But you might need three. But still I work on that. I help you to make it adjustment.
Very nice.
The other thing is Botox. Usually Botox is, we use certain amount for forehead. I like to use that part in the right places. And we have a special $8 per unit.
Okay.
So that's not bad. And a lot of times I combine things. I give discounts. I tell you the truth is discount is not right thing to say.
Right.
But what I've done, I bought a lot of. I buy high voluminous fillers. I pass on the saving to them. Basically,
Yeah, interesting. Very
rather
good.
than to me.
Very nice. Very nice. Thank you so
Thank
much.
you
It
so
was
much.
very informative.
Thank you.
Thank you for coming, and I hope to see you very, very soon.
Perfect. Thank you
Thank
so
you
much.
so much. Good night.
Thank you.
Good night.